Next part of health, women health. Women constitute about half the total population. ऐसा कुछ नहीं है, half से थोड़ी कम है. They suffer many disadvantages as compared to men. ये सही है. In the areas of education, participation in economic activities, and healthcare. The child sex ratio declined from 927 in 2001 to 914 in 2011. It indicates growing incidence of female feticide in the country. Preference for male child. Around 3 lakh girls grow below 15 years of age. Around 3 lakh girls below 15 years of age are not only married but have already born children at least once, mostly in rural areas. More than 50% of married women between the age group of 15 and 49 have anemia and nutritional anemia caused by iron deficiency, which has contributed to 19% of maternal deaths. 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. Women constitute about half of the population. They suffer many disadvantages as compared to men. The child sex ratio declined. मतलब वो तो और ज़्यादा sad है कि decline हो रहा है sex ratio. 914 females as per 2011 data as compared to 1000 males. It indicates growing incidence of female feticide. Around 3 lakh girls below the 15 years of age are not only married but also have children. They have born children at least once. More than 50% of married women between the age group of 15 to 49 have anemia, nutritional anemia caused by iron deficiency, which has contributed to 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. In order to provide basic healthcare to all, accessibility and affordability need to be integrated in our basic health infrastructure. You have to use keywords while giving your answer, the steps which the government can take. Accessibility, affordability need to be integrated in our basic healthcare infrastructure. It is important to create awareness on health and hygiene and provide efficient systems. Try कर रही है government to increase the age to 18 कि 18 से पहले मैरिज नहीं हो सकती. रूरल एरियाज में होती है ना, अभी मुश्किल होगा ये, बट सारा पॉलिटिकल होता है. 18 is definitely a good step अगर हो जाए तो, बट मुश्किल है. रूरल एरियाज में सुनता कौन है इनकी. Next concept, health, a basic human right. In order to provide basic healthcare to all, बार बार रिपीट हो रहे, तो keywords accessibility and affordability needs to be integrated in our basic health infrastructure. The ultimate goal should be to help people move towards a better quality of life. All citizens can get better health facilities if public health services are decentralized. All citizens can get better health facilities if public health services are decentralized. Success in the long-term battle against diseases depends on education and efficient health infrastructure. So it is important to create awareness on health and hygiene and provide efficient systems. Telecom and IT sectors, They also play an important role in improving the health process in the economy. Communication, information sharing, new techniques, the effectiveness, latest technology, the effectiveness of healthcare programs rests on primary healthcare. So, serious steps should be taken to improve them. Private public partnership PPP can effectively ensure reliability, quality, and affordability of both drugs and Medicare. Private public partnership can effectively ensure reliability, quality, and affordability of both drugs and Medicare. तो health a basic human right कह रहे मतलब the government has to take the necessary steps to make it affordable, accessible. It is a basic human right. Next, critical assessment of health infrastructure. Very, very important. अब तो कुछ ज्यादा ही important. Infrastructure में बचा ही क्या? Energy तो चला गया. So critical assessment of health infrastructure is very, very important for a 6 mark. India has built up a vast health infrastructure over the years, but it still suffers from a number of deficiencies. Number one, inequitable distribution of health services. The existing health system suffers from inequitable distribution, balanced growth nahi hai, of institutions and manpower. About 70%, so jo already pad chuke, 70% of India's population live in rural areas, but only 20% of total hospitals are located in rural areas. Most of the modern facilities are available only in urban areas. Communicable diseases. Increasing attention is urgently needed for prevention of communicable diseases like AIDS, acquired immune deficiency syndrome, HIV, SARS, through effective control measures. अब इसको ऐड कर लो COVID-19. Increasing attention is urgently needed for prevention of communicable diseases like AIDS, HIV, SARS, and COVID-19. Poor sanitation facilities. Sanitation facilities are extremely poor in both rural and urban areas. About 30% of the houses in urban areas do not have toilet facilities, and the condition in rural areas is even worse. Improvement in sanitation facilities are immediately needed for good health of the people. Lack of manpower. Even though India produces 12,000 medical graduates every year, अभी तो 44 थे. एक सेकेंड. (380) recognized medical colleges produce 44,000 medical graduates every year. तब भी शॉर्टेज थी मैन पावर की. कहीं पे लिख लेंगे बेटा, पेज 34. ये हेल्थ इंफ्रास्ट्रक्चर में था, हेल्थ एंड हेल्थ रूरल अर्बन डिवाइड. ठीक है, 44,000 में से 20% बाहर चले जाते थे. एक बार बेटा यहाँ छोटा सा एक स्टार लगाएंगे. पेज 34 रूरल अर्बन डिवाइड में 44,000 मेडिकल ग्रेजुएट्स की बात बताई गई है, और क्रिटिकल असेसमेंट में कुछ ज्यादा ही क्रिटिकल हो गए वो. 12,000 मेडिकल ग्रेजुएट्स एवरी ईयर. स्टार लगा दो यार, ये तो मतलब वेरीफाई करना पड़ेगा. इट इज नॉट पॉसिबल. कहीं ना कहीं तो डिस्क्रिपेंसी है ना. ये संदीप गर्ग है. आई विल चेक. जैन हो रही. मैं ग्रुप पे लिख देता हूँ. तो ऐसे एकदम से आपका दिमाग ना एंटेना खड़े हो जाने चाहिए जब भी कोई डेटा ऐसा. ये तो इम्पोर्टेंट डेटा है ना. तो कॉन्ट्रेक्ट जहाँ है खुद ही वो बुक्स में मतलब बहुत बारी कभी 66%, कभी 2/3 पॉपुलेशन रूरल एरिया में होती है, कभी 70% होती है, कभी कुछ होती है. कहाँ कहाँ चेंज कराएंगे हम. एक सेकेंड. पहले तो नंबर ऑफ मेडिकल ग्रेजुएट्स टू बी. वेरीफाई करेंगे. कंटिन्यू करते हैं. अभी लैक ऑफ मैन पावर तो है ही. अभी कर देंगे डिस्कस. Lack of manpower. Even though India produces 12,000 medical graduates every year, still there is huge shortage of manpower. Malnutrition. Widespread malnutrition poses a major threat to lives, especially in case of children. Role of private sector. Public sector has not been so successful in providing adequate health structure. There is a need to increase collaboration of public sector with the private sector to meet healthcare needs of people. Public sector has been inefficient in providing proper health services. The government should take some serious steps to overcome these deficiencies, as improvement in health status is necessary for increasing the productivity and growth of the economy. So, critical assessment of health infrastructure is very important. I think this is the last segment. Mubarak. इंफ्रास्ट्रक्चर ना ओवरऑल. अभी हेल्थ इंफ्रास्ट्रक्चर का क्रिटिकल असेसमेंट था. नॉर्मल ओवरऑल इंफ्रास्ट्रक्चर एसेंशियल फॉर इकोनॉमिक डेवलपमेंट. स्टार्ट भी इसी से करा था, खत्म भी इसी से ही कर रहे हैं. इंफ्रास्ट्रक्चर एक्ट्स एज अ सपोर्ट सिस्टम. इट डायरेक्टली इन्फ्लुएंसेस ऑल इकोनॉमिक एक्टिविटीज by increasing the productivity of the factors of production and improving the quality of life. In the last 6 decades, India has made considerable progress in building the infrastructure. However, its distribution has been uneven in terms of the rural-urban divide. तो बैलेंस नहीं है ग्रोथ. ग्रोथ तो हुई है, बैलेंस नहीं है. Many parts of the rural India are yet to get good roads, telecommunication facilities, electricity, schools, and hospitals. As India is moving towards modernization, there is an increasing demand for quality infrastructure. After the economic reforms of 1991, various concessions and incentives are provided to the private sector and foreign investors in order to attract them for investing in infrastructure facilities. General discussion. जनरल डिस्कशन, शॉर्ट नोट ऑन हाउ इंफ्रास्ट्रक्चर इज एसेंशियल फॉर इकोनॉमिक डेवलपमेंट। तो स्टार्टिंग में भी कुछ पॉइंट्स थे, यहाँ पे भी कुछ पॉइंट्स हैं, ऐड करके आंसर क्रिएट करेंगे। इसी के साथ इंफ्रास्ट्रक्चर खत्म।